What's going on, world? Welcome. Hey, I know y'all missed me. I'm sorry. Your boy was tired last week. He was tired like my eyeballs, right? Eyeballs is just it's all over the place. But ladies and gentlemen, you guys already know what the deal is. We are going to be doing NCLEX questions today. Hey, look, I know I was not here last week, but I want to know who passed that NCLEX. I had a bunch of people that DM'd me that were just like, Kevin, are you okay? Bro, I'm here. We Gucci out here. We good to go out here. You already know what the deal is. So, of course, I want to welcome you all in here. Had a bunch of good things happen to a bunch of good people last week. Just a whole bunch of stuff happened. So you already know what I want. I need 100 people up in here and I need 1,000 likes or we are not going nowhere. Trust and test me if you want to. But hey, what's up, Samantha? How are you? But hey, I want to know who you are, where you're from, where you're at in your nursing journey. You know what I'm saying? If you passed that NCLEX, go ahead and leave it down in the comments. You know what I'm saying? I got a surprise. Got some surprises for y'all. Got some good shout outs, for some folks. So congratulations to everybody that passed that NCLEX. But that's what I want to know. That's what I want to know. Y'all, I'm super excited to tell you guys about what I got going on. And you guys are going to hear about it forever. So you guys are going to hear about it forever until it happens. So what's up from Georgia? Shout out to you. Is it Steffi? Shout out to you. I'm New York, third semester ADN or ABSN, almost there. Hey, almost there. You're good. Shout out to y'all. So, hey, like I said, I need 1,000 likes. I need 100 people up in here. Brittany says I passed my NCLEX on the 23rd. Yes, ma'am. That's what I'm talking about. Congratulations to you. Lovely Chan. Congratulations to you. 2 people came into the chat to tell me that they passed their NCLEX. Hey, if these reviews at all have helped you in any sort of way, hey, send me a DM. Do something along those lines because I want people to know that this is helpful. All right, Ola from Puerto Rico. Shout out to you, Miss Ma'am. Shout out to you. Hey, we got 700 we got 700 likes. I got almost 100 followers. What are we doing? What are we really doing? Hopefully everybody had a really good and safe weekend. You guys didn't go out there and party too hard. You know what I'm saying? So hopefully everybody did really, really well. We're almost to 1,000 likes, y'all. We're almost to 1,000 likes. Yay, it's study time. I know some people were chomping at the bit. They were just like, Kevin, where are you? Well, hey, I'm here. I'm here for you. Lord have mercy. Give me 1 second because I don't know what's going on with that. Because obviously I got a dirty ass camera. Not no more though. Oh, I can't stand myself sometimes, y'all. It's crazy. Hold on. Let me get my life together. So y'all already know what we're doing today. Y'all know what we're doing today. We're doing NCLEX questions. We do these questions every Monday, Wednesday, and Friday, or essentially when I'm not tired at 5:30. So ladies and gentlemen, without further ado, here we go. Ladies and gentlemen, question number 1, which action should you delegate to the experienced nursing assistant when caring for a patient with a thrombotic stroke with residual left side weakness? Select all that apply. Is it assist the patient to reposition every 2 hours, reapply pneumatic compression boots, remind the patient to perform active range of motion or checked extremities for redness and edema? What are we thinking? Shout out to all 200 plus of y'all out here rocking. We're doing NCLEX questions. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes, I'm going to boycott the rest of these questions. So I'm just letting y'all know. So make sure, participation is the key. Y'all got to like, y'all got to share, y'all got to follow. All right. Get it out there. Get it out there to the people that need this. Welcome. If you guys are just joining, we're doing NCLEX questions. It says, bro, I'm so proud of you. Keep up the good work. My man Jay is in the building. My man Jay, what's up, sir? How are you? I appreciate you, brother. Thank you. And here we go. It says, hold on. Somebody said, Kevin, I tested on Friday and found out I passed with 150. Is it Visha 28? You're number 3. Ladies and gentlemen, Visha is number 3. Congratulations to you, ma'am. Congratulations on passing the NCLEX. Welcome to the greatest shit show on earth. To all 3 of y'all, if there is a piece of advice that you guys could give to everybody going to take their NCLEX, what would it be? Hold up. Somebody took my NCLEX on Saturday, found out today I passed. That's what I'm talking about. You're number 4. Hey, same thing to you. Congratulations. Welcome to the greatest shit show on earth. If there's a piece of advice that you could give, what advice would you give to those people? Welcome to nursing. Shout out to all y'all for all y'all's hard work. All right. Congratulations to everybody. But the answers are A, B, and C. The experienced nursing assistant would know how to reposition the patient and how to reapply compression boots and would remind the patient to perform range of motion he has been taught to perform. Remember, UAPs or nursing assistants can reinforce what the nurse originally has taught to the patient, right? So those are well within the scope of practice. That's part of management of care, which is the largest section on the NCLEX at 18 to 21%. 18 to 21%. You may see some numbers that may be skewed a little bit, and that's okay, but it still is the largest section. So congratulations for everybody that got that right. If you got it wrong, you know what to do. Here we go. Question number 2. The patient who had a stroke needs to be fed. What instructions should you give to the nursing assistant who will feed the patient? Is it A, position the patient sitting up in the bed before you feed her? B, check the patient's gag and swallowing reflexes? C, feed the patient quickly because there are 3 more waiting? Or is it D, suction the patient's secretion before or between bites of food? What are we thinking? What are we thinking? Shout out to all 280 y'all out here rocking. Hey, I need for y'all to smash that like button. I need for y'all to share, and I need for y'all to follow. That is the trifecta that the TikToks likes to have. And if we don't have 10,000 likes by the time I get to question 10, I guess y'all are only getting 10 questions today. Your lives helped me pass my NCLEX. I am now an RN in the emergency department. Thank you, Kevin. Kayla, shout out to you. Congratulations on passing your NCLEX. Welcome to the greatest shit show on earth, known as being a nurse. A piece of advice that you could give to everybody. What would that be? What would that be? Kayla, I know you told me that before, but hey, I'm going to give you a shout out again. All right, here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is A, position the patient sitting up in the bed before you feed her. Positioning the patient and sitting up decreases the risk of aspiration, AKA, which could be an airway breathing compromise, right? We don't want to cause any other types of damage to our patients based off of already the issues that they're having, okay? Management of care. Largest section on the NCLEX at 18 to 21%, okay? And also, this is helpful for both RN and LPN, all right? The biggest thing about RN or the biggest thing about LPN is that you need to know what you can and can't do and what you can and cannot accept. The content that you learn in nursing school is the same that an RN will learn. All right. You just need to know what you can and can't do, what you can and can't accept. All right. Here we go. Question number 3. You have just admitted a patient with bacterial meningitis to the med-surg unit. The patient complains of a severe headache with photophobia and a temperature of 102 degrees Fahrenheit orally. Which collaborative intervention must be accomplished first? So what is the very first thing that we are supposed to do? Do I want to administer codeine 15 milligrams orally for the patient's headache? Do I want to infuse cephaloxone or Rocephin 2,000 milligrams IV to treat the infection? Do I want to give acetaminophen 650 milligrams orally to reduce the fever, or furosemide 40 milligrams IV to decrease intracranial pressure? What are we thinking? What are we thinking? Shout out to all 300 plus of y'all. Hey, if you guys don't know, my name is Kevin. I've been a nurse for 3.5 years. It'll be 4 years, June 5th. 4 years, June 5th that I've been a nurse. I've worked ICU, specifically a burn ICU and a medical ICU. I've worked OR and I've also worked PACU. Okay, so I want to know who you are, where you're from, where you're at in your nursing journey, and make sure you guys keep smashing and sharing this live. Get it out to people out there and stop being greedy. Always selfish. You can't have me to yourself. What you think this is? Here we go. Here's our answer in 3, 2, and the answer is B. I want to infuse Rocephin 2,000 milligrams, right? IV to treat the infection. Untreated bacterial meningitis has a mortality rate approaching 100%, so rapid antibiotic treatment is essential. That is part of physiological adaptation. Physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. Danielle, shout out to you. Hey, 1 year in med-surg, shout out to you. All right. Hey, so remember, top 3, you got management of care, pharmacological and parenteral therapies, and you also have physiological adaptation. They make up the top 3. The next one in the line would be risk of reduction. Reduction of risk potential. That's what it would be. It says just pass my NCLEX. You guys got this. Shout out to you, Victor. Shout out to you, Victor, for passing your NCLEX. If there's a piece of advice that you could give to everybody, sir, what would that be? What would it be? Congratulations to you. Welcome to the shit show. Here we go. Question number 4. You are mentoring a student nurse in the intensive care unit while caring for a patient with meningococcal meningitis. Which action by the student requires that you intervene immediately? So the student did something wrong. So we need to go and fix what the student did. So I need to jump in, right? So what is it? The student enters the room without putting a mask on. Without putting on a mask and gown. The student instructs the family that visits restricted to 10 minutes. The student gives the patient a warm blanket when he says he feels cold, or the student checks the patient's pupil response to light every 30 minutes. What are we thinking? Somebody says, Delaney says, I passed my NCLEX last week, just got my job offer in the IMICU. Shout out to you. Delaney, congratulations on passing your NCLEX. Welcome to the greatest shit. Hey, listen, there's so many of y'all that are passing, I can't even keep up. So as I see them, I will give y'all all the love, all right? But congratulations to you. Welcome to the shit show. If there's a piece of advice you could give to everybody studying for the NCLEX, ma'am, what would that be? What would it be? And here's our answer in 3, 2, and the answer is A. The student enters the room without putting on a mask and gown. Meningococcal meningitis is spread through contact with respiratory secretions. So use a mask and gown is required to prevent the spread of the infection to staff and other patients. The other actions may not be appropriate, but they do not require intervention as rapidly. That is part of management of care, which is the largest section on the NCLEX, ladies and gentlemen. Management of care. Who do you see first? Assignment, delegation, supervision. Those are going to be, that's prioritization. That is the biggest section. That is the biggest portions of questions that you will see, or the largest questions that you would see. All right. You got to know that as a nurse. You have to know how to prioritize. All right. And then you need to also know what everyone else is supposed to be doing. And so that is wrong. That is a wrong thing that the student was doing. So we have to correct them. All right. Here we go. Question number 5. A 23-year-old patient with a recent history of encephalitis is admitted to the medical unit with a new onset generalized tonic-clonic seizures. Which nursing activity included in the patient's care will be best to delegate to an LVN whom you are supervising? Select all that apply. Now, LVNs, you need to know based off of the answer choices what you are supposed to accept as the LVN from the RN. I took the old NCLEX U World. Mark Klimek saved me. Shout out to you, Danielle. All right. So is it document the onset time, nature of seizure activities, and post-acute behaviors for all seizures? Do I want to administer Dilantin? Teach the patient about the need for good oral hygiene, develop a discharge plan, including physician visit and referral to the Epilepsy Foundation, or gather information about the seizure activity. What are we thinking? Shout out to all 480 y'all. Y'all got me to 10,000 likes. Oh, y'all thought we was done? We going to 20, baby. We going to 20. Make that happen. Hey, if you're in nursing school right now and you haven't shared this with your cohort, you're wrong. And I'm going to need for you to fix yourself. So I'm going to need for you to do that and do that now. But here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B and E. Administration of medications that are not a high risk is included in LPN education and scope of practice. Collection of data about the seizure activity may be accomplished by an LPN LVN who observes initial seizure activity. An LPN LVN would know to call the supervising RN immediately if the patient started to seize. That is management of care. I think we all see a reoccurring theme here. Management of care, which is 18 to 21% on the NCLEX exam. LPNs, if you got on you guys' test plan, it is coordinated care or coordinating care, which is still the largest section for your exam, right? What you can and can't do, what you can and cannot accept. Vina, welcome. I see you over there. Here we go. On to the next one. Shout out to you. If you got it right, cool. If you got it wrong, revisit that content and keep tackling those questions. Ladies and gentlemen, hey, I have some free testing tips over there for you. You guys go check them out. Thebootnurse.com/test. 42 pages, y'all, of a PDF that is just straight buttery, delicious goodness for this Monday for you. All right. Check it out at thebootnurse.com/test, or you guys can check that link tree out in my bio and that'll take you directly there. It's free. You guys can download it and have at it. So shout out to everybody that's going to be a part of that. Here we go. Question number 6, while working in the ICU, you are assigned to care for a patient with a seizure disorder. Which of these nursing actions will you implement first if the patient has a seizure? Is it A, place the patient on a non-rebreather mask? With the oxygen 15 liters per minute, do I want to administer lorazepam, a 1 milligram IV, turn the patient to the side and protect the airway, or assess level of consciousness during and immediately after the seizure? What are we thinking? What are we thinking, ladies and gentlemen? I'll give you guys 20 seconds. Hey, so something else you guys didn't know about me, if you guys are new here, I was active duty in the Navy for 16 years. I actually just got out of the Navy in January 6th to be exact. So in the Navy, I was a hospital corpsman. I worked bedside. I was a surgical tech. I became an instructor. I've been a master instructor for the last 9 years. So shout out to everybody that's here rocking with me. I love teaching you guys. I love just teaching, period. It's just kind of like my thing. So I appreciate everybody being here. That's a little bit about me. Of course, I want to know a little bit about you. I want to know who you are, where you're from, and where you're at in your nursing journey. All right. But the answer is C. All right. Turn the patient to the side and protect that airway. airway. The priority action during a generalized tonic-clonic seizure is to protect the airway, right? Part of ABCs, all right? So that is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Kimari, NCLEX on Thursday? Cool. I better not see you in my live on Wednesday. Hey, if you are here and you take your NCLEX tomorrow, I'm going to need for you to leave. Mostly it's because I consider this cramming. And if you're trying to cram, what are we doing? That means you don't know the information. You already know the information. Go away. Go relax. Go do something else. All right. Here we go. Question number 7. A patient recently started on Dilantin to control complex or simple complex seizures is seen in the outpatient clinic. Which information obtained during his chart review and assessment will be the greatest concern? Is it A, the gums appear enlarged and inflamed? B, the white blood cell count is 23,000. 2,300. Is it B or C, patient occasionally forgets to take the phenytoin until after lunch? Or is it D, patient wants to renew his driver's license next month? What are we thinking? What are we thinking? All right, you guys, 20 more seconds. Hey, by the way, if I go over my 20 seconds, I don't need for you to take time from me. If I do it a little bit longer, hey, that means you get a little bit longer to look at the question. Am I right? Am I right? You know what I'm saying? Here we go. Here we go, ladies and gentlemen. Hey, don't think I don't see some of the comments y'all say. Y'all think y'all slick. Don't think I won't clap back at you either. Because if you new here, just know. Just know. All right, here we go. Here's our answer in 3, 2. And the answer is B. The white blood cell count is 2,300. Leukopenia is a serious adverse effect of phenytoin and would require discontinuation of the medication. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. It actually just went up after April 1st of last year. It was 14 to 18. Now it's 13 to 19 because it covers more, right? You got to know. You got to know. You got to know pharmacology. Pharmacology is not going anywhere. All right. The last thing I would ever want is for you guys to give a medication blindly and you don't know what it does. There's nothing wrong with you looking the medication up. Pull that phone out and use Google. All right. Ain't nothing wrong with it. It says, I'm not in the medical field. I'm just interested. I don't know what your name is, but cool. I'm glad that you're here. I'm glad that you're here getting your learn on. All right, here we go. Question number 8. After receiving a change of shift report at 7 a.m., which of these patients would you assess first? I can only guess what section of the NCLEX this falls under, but let's see what it is. A 23-year-old with a migraine headache who is complaining of severe nausea associated with retching. Is it a 45-year-old who is scheduled for a craniotomy in 30 minutes and needs preoperative teaching? A 59-year-old with Parkinson's disease who will need a swallowing assessment before breakfast? Or is it a 63-year-old with multiple sclerosis who has an oral temperature of 101.8 and flank pain? What are we thinking? Shout out to all 620 y'all out here rocking with me. We're doing NCLEX questions. If you're new here, they're both for RNs and LPNs. Make sure you guys smash that like button. You guys share, you guys follow. That is the trifecta that TikTok needs to get out to the For You page that people need this. You know what I'm saying? And of course, I want to know who you are, where you're from, and where you are at in your nursing journey. Got a bunch of people saying D. Okay, got a bunch of A's out there. A or D, you got to give me one. You got to give me one, all right? You got to give me one. But here we go. Here's our answer. Here is our answer in 3, 2. And the answer is D, a 63-year-old with multiple sclerosis who has an oral temperature of 101.8 degrees Fahrenheit and flank pain. Urinary tract infections are a frequent complication in patients with multiple sclerosis because of the effect on bladder function. The elevated temperature and decreased breath sounds suggest that this patient has, pyelonephritis. There we go. Pyelonephritis. The physician should be notified immediately so the antibiotic therapy can be started quickly. That is part of management of care. Management of care, which is what? The largest section on the NCLEX. The largest section on the NCLEX at what? 18 to 21%. 18 to 21%, ladies and gentlemen. All right. So shout out to everybody that got that right. It says 5 years, ED, here, graduated RN in May, ICU, here I come. That's what I'm talking about. 100.4. Anything above that is considered a fever. All right. Per the literature. All right, here we go. Question number 9. All of these nursing activities are included in the care plan for a 70-year-old man with Parkinson's disease who has been referred to your home health agency. Which ones will you delegate to the nursing assistant? Select all that apply. Is it A, check for orthostatic changes in pulse and blood pressure? Is it B, monitor for improvement in tremors after levodopa is given? Remind the patient to allow adequate time for meals. Monitor for abnormal involuntary jerky movements of extremities. Assist the patient with prescribed strengthening exercises. Adapt the patient's preferred activities to his level of function. What are we thinking? Miranda, good afternoon. Well, good evening. Well, I guess it's still in the afternoon. It's only 5:52 here, so shout out to y'all. Shout out to all 500 of y'all out here rocking. We're doing NCLEX questions. So we're doing a select all that apply. So I would expect to see more than one answer, of course. And if anybody's interested, I got these questions off of nurseslabs.com. Nurseslabs.com. They're free sets of questions. You guys can go over there and check them out for yourself. All right. Here we go. Here we go. From Indiana, graduate May of 24. Shout out to you. Is it Joa? There we go. Here we go. Ebony, Miss Ma'am, thank you for the rose. Here we go. In 3, 2, and the answer is A, C, and E, because I know y'all about to come for me in the comments if I say something wrong. All right, here we go. So a nursing assistant education and scope of practice include taking pulse and blood pressure measurements. In addition, nursing assistants can reinforce previous teachings or skills taught by the RN or other disciplines such as speech or physical therapist. That, of course, is part of management of care, which is the largest section on the NCLEX at 18 to 21%. So shout out to y'all. Anita, how are you? You disagree? Oh, you don't disagree. I thought you were telling me like you disagree. I'm like, well, hell, I don't know what you want me to tell you after that. Thoughts on NCLEX high yield for content review? Dr. Z, he does his thing. No disrespect to his platform. I have an issue with doctors that teach nurses how to be nurses. But, you know, I've never used his stuff. I've heard some good things about it. So, you know, can you go back? I cannot go back. Just like on NCLEX, we don't go back. You can't go back on NCLEX, so we don't go back on these questions. So there's that as we press forward. So shout out to all 500 y'all. Here we go. Question number 10. As the manager in a long-term care facility, you are in charge of developing a standard plan of care for residents with Alzheimer's disease. Which of these nursing tasks is best to delegate to the LPN team leaders working in the facility? Is it A, check for improvement in resident memory after medication therapy is initiated? Is it use the mini mental state examination to assess residents every 6 months? Assist residents to the toilet every 2 hours to decrease the risk of urinary incontinence? Or is it D, develop individualized activity plans after counseling with residents and families? What are we thinking? Shout out all 482 of you guys and gals out here rocking with me. We're doing NCLEX questions. Hold on a second. Hey, you can come in here and ask me, anything about, hey, we're doing NCLEX questions. Don't come in here and start asking me about whatever religious preference I am. Try Jesus, not me. Okay. So I'm just letting y'all know what the deal is. But hey, pray to whoever y'all pray to. All right. And here's another thing that I want to make you guys aware of. I failed my NCLEX 3 times. I failed my NCLEX 3 times, ladies and gentlemen, not once, not twice, but 3 times. And let me tell you something. 2 individuals that are not going to care, your job and your patient. Get out of your own way, get out of your own head, put in the work, understand why you got things wrong. All right. Understand why you got things wrong. Period. Understand why you got things wrong and then tackle it again. All right. Tackle it again. Get out of your own way. Stop playing games. You didn't let me know again. What you talking about? Geraldine, you already supposed to know. I told you I was going to be live today. But the answer is A, check for improvement in resident memory after medication therapy is initiated. LPN education and team leader responsibilities, including checking for the therapeutic and adverse effects of medications. Changes in the resident's memory would be communicated to the RN supervisor, who is responsible for overseeing the plan of care for each resident. That is management of care, which is the largest section on the NCLEX exam. All right, at 18 to 21%. So shout out to you. Says, oh my God, I was right. I need to go with my gut. Coco, come on now. Don't ever change your answer unless you can definitively tell me why you are changing your answer. Don't you ever, ever, ever change your answer. All right. So, and that's another thing. When you guys are doing your questions, read your rationales, understand why it's right, and then go to the answers and understand why those are wrong. All right. You have to understand, you got to go to those and you have to understand why those answers are wrong. That's why it's part of reading your rationales. The rationales help you retain the information that you are reading. All right. And ladies and gentlemen, of course, I have an NCLEX ebook essentially to help you conquer the NCLEX. You want to know why? Because conquering the NCLEX begins with you. It's nobody else's fault. We can blame school all we want, but guess what? We still have the responsibility of picking up what we need to learn and get it so we can pass the NCLEX. So you guys can check that out, thebootnurse.com/victory. That's over 700 pages to include management of care, pharmacology, delegation, everything that you would need to pass the NCLEX. So you guys can most definitely go over there and check that out for yourself. All right, but here we go. Question number 11. An 89-year-old female patient who has been admitted to the medical unit has a new onset angina, also has a diagnosis of Alzheimer's disease. The patient's husband reports to you that he rarely gets a good night's sleep because he needs to make sure his wife does not wander during the night. He insists on checking each of the medications you give her to be sure that they are the same ones that she take at home. Based on this information, which nursing diagnosis is most appropriate for this patient? Is it A, decreased cardiac output related to poor myocardial contractility? Is it a caregiver role strain related to continuous need for providing care? Ineffective therapeutic regimen management related to poor patient memory? Or is it risk for falls related to patient wandering behavior during the night? What are we thinking? Shout out to all 500 of y'all out here rocking with me. All right. Got these questions off nurseslabs.com. Hey, by the way, I see some people talking about, hey, these are too vague, so on and so forth. Hey, so depending on where you get questions, some will be vague and some will be like, there'll be so much information that you'll actually just be like, okay, like what's the information that I really need to know? So, but regardless, you still get the knowledge. You still get the knowledge. What you talking about? You hate it so much. You hate studying? Hey, trust and believe me, you ain't the only one that hates studying, but it's a part of the process. Trust the process. All right. You got to get it. All right. 10 more seconds, y'all. 10 more seconds. I would say D. Cool. All right. You could say D. I hate the question setup. It's okay if you hate the question setup, but just answer the question. Callie says NCLEX is geared to safety, so risk fall is D. Okay. Well, let's see. Here's our answer. Here is our answer in 3, 2, and the answer is B. It's the caregiver role strain related to continuous need for providing care. All right. The husband's statement about lack of sleep and anxiety over whether the patient is receiving the correct medication and behavior that supports this diagnosis. All right. That is part of basic care and comfort. Basic care and comfort. So, hey, whether you like it or not, it doesn't matter if you like it or not. The whole point is for you to get into a rhythm and understand what these questions are asking you. That's what it's about. It's about understanding what these questions are asking you. The more you go against the grain and the more you try to be upset about how the questions are, how they're mapped out or anything like that, the longer and harder you're going to have grasping what they're asking you and not doing well. All right. So you can be upset all you want, but answer the question. Answer the question. All right. Here we go. Question number 12. You are caring for a patient with reoccurring glioblastoma who is receiving dexamethasone 4 milligrams IV every 6 hours to relieve symptoms of right arm weakness and headache. Which assessment information concerns you the most? Okay, so what is the thing that is the most? All right. The patient does not recognize family members. The blood glucose level is 234. The patient complains of a continuous headache, or the daily weight has increased by 1 kilogram. What do we think it is? All right. So the key word is most. All right. But let's think about dexamethasone. What does it do? What does dexamethasone do to our patient? Right? Steroids cause high blood glucose. Okay. All right. Parasites. What? What are we talking about? Increase B. Okay. All right. It's a steroid. Okay. What are we talking about? Parasites. What are we talking about? Where do you see anything about parasites, my guy? Anyways, here we go. Here's our answer, y'all. That's a good one too. Arabella, that's a good one. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A. The patient does not recognize family members. The inability to recognize a family member is a new neurologic deficit for this patient and indicates the possible increase of intracranial pressure. All right. This change should be communicated to the physician immediately so that treatment can be initiated. Pharmacological and parenteral therapies, right? So you're not wrong. You're not wrong. Somebody said something about increasing the blood glucose, but that's an expected finding because that's what a steroid does. What in the absolute hell are you talking about is a parasite? What are we talking about? D, come on, you got to make it make sense to me, guy. You got to make it make sense. As a matter of fact, it doesn't matter because I just blocked you because now you're annoying. Anyways, pharmacological and parenteral therapies, ladies and gentlemen, which is the second largest section on the NCLEX at 13 to 19%. I'm testing in 3 weeks and I'm so nervous. It's okay for you to be nervous. I expect for you to be nervous, but you have to practice. Practice to the test, ladies and gentlemen. You already know where it's going to be. You already know. You already know where it's going to be. You already know what the testing centers are going to look like. Look, you got it. All right. You got it. Question 13. A 70-year-old alcoholic patient with acute lethargy, confusion, and incontinence is admitted to the hospital ED. His wife tells you that he fell down the stairs about a month ago, but he didn't have a scratch afterwards. She feels that he has become gradually less active and sleepier over the last 10 days or so. Which of the following collaborative interventions will you implement first? So what is the first thing that I want to do? All right. Do I want to place on the hospital alcohol withdrawal protocol, transfer to radiology for a CT scan, insert a retention catheter to straight drainage, or give Dilantin 100 milligrams PO? What are we thinking? Well, Siwa. Okay. All right. I see you, Siwa. I may or may not have dealt with a bunch of alcohol withdrawal patients in my time. All right. Shout out to all 400 plus of y'all. Hey, we are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. If y'all are mad at the way that they're written, y'all go over there and complain. I'm just the messenger and the deliverer of what's here. All right. And plus, we talk about those things. We talk about them. All right. So, of course, I want to know who you are, where you're from, and where you're at in your nursing journey. Give me the 20,000 likes and stop playing games. All right, y'all. Here we go. Here we go in 3, 2, and the answer is B. I want to transfer to radiology for a CT scan. The patient's history and assessment data indicate that he may have a chronic subdural hematoma. The priority goal is to obtain a rapid diagnosis and send the patient to surgery to have the hematoma evacuated. That's part of management of care. George, it's okay. Jorge, it's okay. Management of care, largest section on the NCLEX exam at 18 to 21%. So, ladies and gentlemen, remember, it's all about getting into a rhythm. You have to practice. If there's certain areas that you know that you don't do well on, get them wrong here. Go practice. That way you don't get them wrong when you go take it where it truly, truly matters. And that's when you're going to take that exam. I like to say practice like you play or train how you fight. If you train subpar, or if you're not studying correctly or you study subpar, you're going to do subpar on that exam. I'm telling you. I'm just letting you know. So train how you fight. Question 14. Which of these patients in the neurologic ICU will be best to assign to an RN who has floated from med-surg? All right. So what are we thinking? What are we thinking in regards to, hey, I have somebody who is not familiar to this floor. What patient would I give them? OK, so is it a 26-year-old with a basilar skull for us, a skull structure who has clear drainage coming out of the nose? A 42-year-old patient admitted several hours ago with a headache and diagnosed with a ruptured berry aneurysm. A 46-year-old patient who was admitted 48 hours ago with bacterial meningitis and has antibiotics dose due, or a 65-year-old with astrocytoma who has just returned to the unit after having a craniotomy. What are we thinking? Is it is it Noelia? Did you say V? Oh, she said, okay, I got you. I'm picking up what you're putting down. Hey, ladies and gentlemen, as somebody who's failed the NCLEX multiple times, I'm telling you right now. All right. I'm telling you right now. Get out of your own way. Stop crying about it. Stop telling me that you're scared. That test don't got no type of emotional tie to you. But all of a sudden, you scared of it. If you're scared, go to church. All right. And then guess what? You're still going to do that scared. So guess what else you're going to do? You're going to go take the exam scared. All right. But you have to prepare for it. You have to prepare for it. But here we go. Here's our answer. Here is our answer in 3, 2, and the answer is C, a 46-year-old patient who was admitted 48 hours ago with bacterial meningitis and has an antibiotic dose due. This patient is the most stable of the patients listed, and RN from the medical unit would be familiar with the administration of IV antibiotics. Once again, management of care. Management of care. When you have people that are floated from one unit to another that are not familiar, you give them the most stable patients, just like you would give a new grad the most stable patients. You see what I'm saying? You see what I'm saying? Stop playing games. You know what I'm saying? Y'all got this, but you have to practice. You have to practice. Here we go. Question 15. What is the priority nursing diagnosis for a patient experiencing a migraine headache? Is it A, acute pain related to biologic and chemical factors? B, anxiety related to change in or threat to health status? C, hopelessness related to deteriorating physiological condition? Or D, risk for side effects related to medical therapy? What are we thinking? What are we thinking? Shout out to y'all getting me to 21,000 likes, but y'all already know the deal. Y'all know where we're going next. 30, baby. Let's get there. 30 and share it, by the way. If you're in nursing school right now and you haven't shared it to people you're in cahoots with, because apparently that's a thing, that's an app that the kids are in nowadays. What are you doing? I don't care if they don't click on it. Share it to them. You never know. You never know. All right, but here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A, acute pain related to biologic and chemical factors. The priority for interdisciplinary care for a patient experiencing a migraine headache is pain management. Pain management, ladies and gentlemen. All right, physiological adaptation, 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX. So shout out to everybody that got that right. Hey, listen, you need content, you need questions and answers, and you need a rationale. You need all three. There is no tricks to studying for this exam. All right, it's called putting in the fucking work. That's what it's called. Sorry, hey, if you don't like the F word, you're going to have a hard time being a nurse. I'm just letting you know. Ladies and gentlemen, and here it is. I'm writing a book, and right now, it's on pre-order. It's on pre-order right now. I actually talked about it, and we launched the pre-order yesterday. It's called Conquer It. It's called Conquer It, ladies and gentlemen, and it's called The Journey to Passing the NCLEX, and it's my journey on passing the NCLEX. You want to know why? Everybody's journey is going to be different, but the destination is still the same, ladies and gentlemen. The destination is still the same. And it's becoming a nurse to going out here to do great things. So Conquer It, The Journey to Passing the NCLEX. You can find it down there at the link at thebootnurse.com/books, or you can find it in my link tree, which is in my bio. Right now, we're doing it on the Kindle, and on the Kindle version, it is going to be $14.97. And then we're going to be doing it on paperback. And then when paperback comes out, it's going to be $24. All right. But right now it's on Kindle for pre-order. And then as this thing starts to come out, I'll start passing more information. But hey, y'all go over there and y'all check that out and get that pre-order and get that deliciousness that's going to be coming out. You know what I'm saying? Here we go. Question. And I'll talk more about it after this. But question 16, Nurse Michelle should know that the drainage in normal 4 days after a sigmoid colostomy when the stool is what? Is it green liquid, solid formed, loose and bloody, or semi-formed? What are we thinking? Is it like an NCLEX? Is it like a NCLEX like a help book? So essentially, it's going to be me telling you about what my journey was on the NCLEX, ways to help you, right? And ways to motivate you. Because as somebody who failed the exam 3 times and passed it on the 4th, a lot of people will take it one time and will never take the exam again because they're so scared of a computerized test that don't got nothing to do with them. And so it's about adversity. It's about motivation. It's about telling you, hey, get off your beach. It's about telling you, stop being scared. Get out there and put in the fucking work. If you really want to be a nurse, who gives a shit about what everybody else is going to say to you? It's not their journey. It's yours. Period. All right. Everybody always got something to say about somebody else's life when they ain't walked a day in their shoes. And none of y'all walked a day in my shoes. And so I'm going to tell y'all my story. And I want the story to resonate with all of y'all, even if you took the exam one time. And the answer is C. It's loose and bloody. Normal bowel function and soft formed stool usually does not occur until around the seventh day following surgery. The stool consistency is related to how much water is being absorbed. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. Get off your Normandy. Geraldine, you know what's up. You know what's up. You know what's up. Get off Normandy. Get off that beach. All right. But there's the rationale, ladies and gentlemen. Hey, you may not have to agree with it. And here's another thing. I could ask you 100 questions, but we could say 9 to 10 of them are just going to be wrong or they're not going to make any sense. By the way, you're going to get 15 research questions on NCLEX that are not even going to count. All right. They're not even going to count because they're research questions. So technically you will only be graded on 70 questions. At least at the bare minimum. OK, but you'll never know what those research questions are. Somebody said, what department do you work in now? I am currently homed to the operating room. All right, here we go. Question 17. Where would nurse Christine place the call light for a male client with a right-sided brain attack and left, oh my God, the hominosis, hemanospia, whatever, bro. On the client's right side, their left side directly in front of the client, or where the client likes. Hey, by the way, just because you're a nurse doesn't mean that you have to understand what it's like to be in a spelling bee with a bunch of 10-year-olds. You know what I'm saying? It's okay. Some of these words you'll never say again. And you'll have somebody that try to talk shit to you saying, how do you not know how to say that? Who cares, bro? As long as you know what it is. Sorry. I'm just telling you. By the way, if you guys are just now joining and listening to me rant, you got this question on my NCLEX. Look at that. If you guys are just now joining, we're doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. All right. And here we go. And the answer in 3, 2, and the answer is A, on the client's right side. The client has left visual field blindness. The client will see only from the right side. This condition, it's a condition in which a person sees only one side, either left or right, of the visual world of each eye. The person may not be aware that the visual loss is happening in both eyes, not just one. An injury to the right part of the brain produces loss to the left side of the visual world of each eye. That is physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. So shout out to everybody that got that right. Hey, and if you got it wrong, you know what to do. Circle back, get the content, and keep doing your questions and answers. What does BSN and RN mean? BSN is your degree. Your RN is your license. You can have an associate's degree and have an RN license. You can have a bachelor's degree and have an RN license. Your BSN and ADN are your degrees that you get from your school. Your licenses, your RN and the LPN aspect are the licenses, okay? Here we go. Question number 18. A male client is admitted to the emergency department following an accident. What are the first nursing actions of the nurse? What is the very first thing that you do for a patient coming into the emergency room? All right, do I want to check respiration, circulation, neurological response? Align the spine, check pupils, and check for hemorrhage. Check respiration, stabilize the spine, and check for circulation, or assess the level of consciousness and circulation. What are we thinking? What are we thinking? Shout out to everybody out here rocking. We're doing NCLEX questions on the road to 30,000 likes. Y'all are smashing that like button. I appreciate y'all. Give me to the For You page. Can I be an RN without a BSN? Yes, it's called get your RN as an ADN. You have to have one or the other. You have to have at least the minimum of an associate's to get to even qualify to go sit for the registered nurse exam. Okay. B or C. Okay. Give you guys 10 more seconds. Is it Miss Hoskins? Thank you for the rose, ma'am. I appreciate you. Associates in nursing. There you go, Sam. Let them know. For You page, homie. Shout out to you, Samantha. I got another Samantha from the For You page. Appreciate you. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. How challenging can ADN program be? Just as challenging as BSN program. Nursing school is not easy. I don't give a shit what anybody tells you. You'll find people that say nursing school is easy, but I'm telling you, 9 out of the other 10 people will not tell you that. All right, but the answer is C. Check respiration, spinal, or stabilize the spine and check for circulation. Checking the airway would be the priority, and neck injury should be suspected. Airway patency and adequate respiration effort are both essential for normal oxygenation and ventilation within the body so that normal physiological processes can proceed without metabolic derangement. That is physiological adaptation, 11 to 17%. On the NCLEX exam at 11 to 17%. Like I said, it says I'm in an LPN bridge program right now, ADN, and it's really difficult. That's what I'm saying. It just because some people are just like, hey, go LPN. LPN, even if you went LPN ain't no easier. I'm sorry, that's improper English. LPN isn't any easier. All right. So I'm just saying. If you can go BSN, go to BSN route. If you can go ADN, go that route. If you can go LPN, go that route. However your pockets are feeling. Trust and believe me. What's up, Gabby? How are you? Question 19. In evaluating the effect of nitroglycerin, Nurse Arthur should know that it reduces preload and relieves angina by what? So what does nitroglycerin do? I can almost guarantee I know what section this came from. Does it increase contractility and slow heart rate, increase AV conduction and heart rate, decrease contractility and oxygen consumption, or decrease venous return through vasodilation? What are we thinking? What are we thinking? Hey, remember, that's another thing as well. You guys got to remember that this is NCLEX world. These are NCLEX world. All right. Jamie says D. All right, Jamie, I see you out there. All right, 10 more seconds, y'all. 10 more seconds. Hey, if you guys are just now joining, my name is Kevin. I've been a nurse for 3.5 years. I've worked ICU, OR, and PACU. I was in the Navy for 16 years. Did a bunch of stuff, but last stuff I did is I was an instructor. I was an instructor for the last 9 years. And I failed my NCLEX 3 times. So there's that. I want to know about you and who you are and where you're from and where you're at in your nursing journey. And if you're not a nurse, what are you doing here? Mia, you're Navy. Shout out to you. What's your rate in the Navy? We can start talking Navy to each other. Trust and believe me. But the answer is D. It decreases venous return through vasodilation. The significant effect of nitroglycerin is vasodilation and decreased venous return, so the heart does not have to work hard. All right, that's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam. Second largest section on the NCLEX exam. All right, at 13 to 19%. I'm pretty sure I said 14 to 18 before, but I always get those mixed up. So as I failed my NCLEX twice this time around, I'm more motivated. That's what I'm talking about. All right. So shout out to you. Hey, if you got it wrong or if you don't understand it, guess where you're going? Back to content. Go back to the content and read the fine print, and also read your rationales. Understand why it's correct and then understand why it is not correct. All right. Don't go against the grain. Don't go against the grain, ladies and gentlemen. Read it and understand why. All right, here we go. Question number 20. Nurse Patricia finds a female client who is post-myocardial infarction slumped on the side rails of the bed and unresponsive to shaking or shouting. What is the nurse's next action? What are we doing? Hey, Miss Patricia or Miss post-myocardial infarction. Hey, can you hear me? I get nothing. Right, so what do I do next? Call for help and note the time. Check the airway. Right. What is it? Give 2 sharp thumps to the pericardium and check the pulse, or administer 2 quick blows. What are we thinking? Shout out to all 602 of y'all. Make sure you guys keep smashing that like button. You guys share. You guys follow. Hey, we're on the road to 30. I'm just going to say 40,000. We're on the road to 40,000 likes. Make that happen. Make that happen right now. If you guys are in nursing school right now, what are we doing? Share it to, I don't care how you feel about them. I don't care who you get into an argument with. Share it to them. That way you could just say, hey, when they fail, be like, I told you should have joined the live. See what I'm saying? Then you could be petty because that's what most people do. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is call for help and note the time. All right. All right. I know somebody's about to be like, why? What do you mean? Right. But this is why it's important for you to read your rationales. OK, so having established by stimulating the client that the client is unconscious rather than sleep, the nurse should immediately call for help. This may be done by dialing the operator from the client's phone and giving the hospital code for a cardiac arrest and the client's room number to the operator, or if the phone is unavailable, by pulling the emergency call button. Noting the time is important baseline information for cardiac arrest procedures. Cardiac arrest procedures, ladies and gentlemen, that's part of physiological adaptation. Third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. Shout out to everybody that got that right. CPR 101. Hey, you can't hear me? Oh, my God. Help. So start those chest compressions. It says, hold on. Gabby says passed. Oh, shout out to you, Gabby. You're welcome. Hey, Gabby, you already know what I'm about to do. Welcome to the greatest shit show on earth, known as being a nurse. If you could give one piece of advice, ma'am, what would it be? Hey, Gabby's been a frequent flyer for a long time, y'all. So shout out to you. What piece of advice would you give to everybody here that is taking the NCLEX? And once again, shout out to you for passing that NCLEX. Can you retake 7 times? Depends on your state. Ladies and gentlemen, I have an NCLEX course right now. You can join it for $7. You can join it for $7 for 7 days. And if you don't like it, you can cancel your subscription. After 7 days, it goes to $48. I have over 65 videos in there to include 2 NCLEX reviews. One NCLEX review based off of the 8 sections of the client needs, and another one is just a straight new next generation NCLEX review. All right, you guys can go in there. Also, there are content videos, and you guys get to be a part of a community where I go live 3 times a week. So you guys can go over there and check that out, thebootnurse.com/special. Also, you guys can check that link out in my bio. It's also in my link tree, but you guys go over there and check it out. Get it for $7 and stop playing games and come be a part of the community. All right, here we go. Question number 21. Nurse Monette is caring for a client recovering from gastrointestinal bleeding. The nurse should what? Is it A, plan care so the client can receive 8 hours of uninterrupted sleep each night, monitor vital signs every 2 hours, make sure that the client takes food and medications at prescribed intervals, or is it provide milk every 2 to 3 hours? What are we thinking? What are we thinking, ladies and gentlemen? You guys already know what I'm going to do. We read questions, we read the answers, we read the rationales. Why? Because that's what you are supposed to do. Get into the habit of reading your questions all the way through. RTFQ, RTFA, RTFR. Let them know. Take a guess on what they mean. 15 seconds. Everybody saying B. Okay. Okay, got some C's, got some B's. I just passed my NCLEX. Shout out to you, Sabrina. Congratulations. You're like person number 10. Welcome to the greatest shit show on earth, known as being a nurse. Hey, I'm just letting you know, CRNA here. This is great content. Is it Evan? Shout out to you, Mr. or Miss CRNA, for being up in here. I wanted to be like you one day, but I gave up on that dream. But anyways, shout out to you, Sabrina. Welcome to the greatest shit show on earth, known as being a nurse. If you could give one piece of advice, what advice would that be to everybody that's in here rocking with us? All right. Once again, congratulations to you. But the answer is C. Make sure the client takes food and medications at prescribed intervals. Food and drug therapy will prevent the accumulation of hydrochloric acid or will neutralize and buffer the acid that does accumulate. All right. That's part of physiological adaptation, which is 11 to 17% on the NCLEX exam. Third largest section. All right. Third largest section. Remember, I would rather you get it wrong here, and I'm telling you to go back and get the content and find out what the answers are, than you get them wrong on NCLEX. All right. It says, Maddie says, so what did you do after you failed after the 3rd time? I fixed myself. That's what I did. There's a lot that I did, and I could talk about that at a later time. But shout out to you, Gabby. But shout out for your questions. All right. Question 22. A male client is on warfarin, Coumadin. All right. Before admission and has been receiving heparin IV for 2 days. The partial thromboplastin time is 68 seconds. What should Nurse Carla do? Stop the IV infusion of heparin and notify the physician. Continue treatment as ordered. Expect the warfarin to increase the PTT, or is it increase the dose because the level is lower than normal? What are we thinking? So who can tell me what section of the NCLEX client needs that this falls under? Who can tell me that? Who can tell me? I know some of y'all got some smarty pantses up in here. I know you guys can tell me. Protocols. Okay. Okay. Management. Okay. Okay. Farm. Okay. Normal is 50 to 100. Okay. Physiological care. Okay. You guys are thinking. And you know what's crazy is that we're talking about a medication. We're talking about safety administrating it. And we are talking about, hey, what do we do if it's out of range or if it's not out of range? All of those, they will fall under the same categories, topics and subtopics. All right. So here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B, continued treatment. All right, continue treatment as ordered. The effects of heparin are monitored by the PTT is normally 30 to 45 seconds. The therapeutic level is 1.5 to 2 times the normal limit or normal level. All right, that is part of pharmacological and parenteral therapy. Easiest way that you could have guessed that is because we were talking about a medication and we were talking specifically about heparin. All right. Heparin. All right. That's why you got to RTFQ, ladies and gentlemen. What does RTFQ mean? Somebody tell me if you've been in my lives long enough. Tell me what RTFQ means. All right. Here we go. Question number 23. A client underwent ileostomy. A ileostomy. When should the drainage appliance be applied to the stoma? Read the F in question. RTFQ. Oh, you must be new here. Read the F in question. Yes, y'all already know the deal. Y'all know what's up. Y'all know how I do. All right. Anytime y'all hear me say RTFQ, you best do it. All right. So is it 24 hours later when edema has subsided in the operating room after the ileostomy begins to function, or when the client is able to begin self-care procedures? What are we thinking? Shout out to all 362 of y'all. We're doing NCLEX questions. I got them off nurseslabs.com. They're free sets of questions. Hey, you guys can go over there and check them out for yourself. If you're a nursing student, they also have care plans over there. Trust me, when I was in school, I used them. They saved my life, and they most definitely will save yours. So go over there and get your learn on with some of those free things that they have going on. Okay. Yes, those save me. Let them know, Gabby. Let them know. 10 seconds. 10 seconds. Got a bunch of people saying B. The site, Taylor, the site is nurseslabs.com. Nurses meaning more than one. Labs also meaning more than one.com. The interwebs. Nurseslabs.com. Here we go. Here's our answer. In 3, 2. You're welcome, Taylor. And the answer is B, in the operating room. The stoma drainage bag is applied in the operating room. Drainage from the ileostomy contains secretions that are rich in digestive enzymes and highly irritating to the skin. Protection of the skin from the effects of these enzymes is begun at once. Skin exposed to these enzymes, even for a short time, become reddened, painful, and excoriating. Excoriating. Okay, so physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. So shout out to everybody that got that question right. Appreciate everybody getting me to 30,000 likes. You already know what the deal is. Go ahead and give me the 40, baby. Go ahead and get that carpal tunnel for me, all right? Here we go. Question number 24. A client has undergone spinal, all right, aesthetic. Oh, hold on. Something's going on. Hey, can you guys hear me? Everybody, can y'all hear me? I kind of had like a glitch. Hey, give me a thumbs up if you guys can hear me. I don't know what was going on there. Thumbs up. Yes. Sweet. All right, here we go. A client has undergone spinal aesthetic. It will be important that the nurse immediately position the client in what position? All right, on the side to prevent obstruction of the airway by the tongue, flat on the back with knees flexed 15 degrees, or flat on the stomach with the head turned to the side. A bunch of y'all are saying B. A bunch of y'all are saying C. All right. Let's see what we got. All right. Here we go, y'all. Here's our answer in 3, 2, and the answer is B, flat on back. To avoid the complication of painful spinal headache that can last for several days, the client is kept flat in a supine position for approximately 4 to 12 hours post-operatively. Headaches are believed to be caused by the seepage of cerebral spinal fluid from the puncture site. By keeping the patient or the client flat, cerebral spinal fluid pressures are equalized, which avoids trauma to the neurons. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. And it actually is the fourth largest section on the exam, ladies and gentlemen. The top 4 make up more than half of the NCLEX. So management of care, pharm, physiological adaptation, and reduction of risk potential make up more than 50% of the entire NCLEX exam. All right. So just letting y'all know. Shout out to y'all who got it right. All right. Here we go. Question number 25. While monitoring a male client several hours after a motor vehicle accident, which assessment data suggests increased intracranial pressure? All right. So which one? All right, blood pressure has decreased from 160 over 90 to 110 over 70. Pulse has increased from 87 to 95 with an occasional skipped beat. The client is oriented when aroused from sleep and goes back to sleep immediately, or the client refuses dinner because of anorexia. What are we thinking? So think about it. If I'm having a perfusion issue, right? If I'm having a perfusion issue, what is going to be the very first? What is one of the things that you are going to see? Samantha says decreased level of consciousness. Okay. Consciousness. Okay. I see you. Got B. Got B. Remember, on the NCLEX, ladies and gentlemen, it's all about using your critical thinking in order for you to make a clinical judgment. You guys can go and read the test plan. That's exactly what it says. All right. You need to be able to critically think in order you have to critically think to make a clinical judgment and a safe clinical judgment. All right, here we go. Let's see what the answer is. Let's see what the answer is in 3, 2. And the answer is C. The client is oriented when aroused from sleep and goes back to sleep immediately, right? This finding suggests that the level of consciousness decreases. Somebody that has a level of consciousness that decreases, that is telling me that they're also having a perfusion issue, right? Because what does our blood do? What do the pipes in our body do? They pump blood and oxygen to our brain and to our heart, right? So that's telling me that I'm not getting enough perfused anything to my brain. You see what I'm saying? Level of consciousness is also part of ABCs. They may not talk about that, but you need to know it. That's how you're able to use your critical thinking in order for you to make a clinical judgment. Ladies and gentlemen, if y'all don't know who this young man is right here, this is my man, Antoine A.J. Inslee. All right. He passed his NCLEX. I believe it was like sometime last week, like last Thursday on the 16th, something like that. Right. He got 105 questions on his first attempt. All right. On his first attempt, all with coaching, ladies and gentlemen. And when I tell you, my man, he killed it. He killed it. He was nervous like everybody else. He followed the instructions. He followed what I gave him as guidance, and my man conquered. And now my man is a registered nurse, and he's about to go work in a cardiovascular ICU because that's where my man wants to go. He wants to go be a CRNA like all the other CRNAs that are out here. So if you're one of those individuals that if you failed the exam multiple times, you don't know where to start, you don't know where to begin, you don't know how to just get out of your own way, you need somebody to point you in the right direction, guide you, break down questions with you, whatever you need, check me out, bootnurse.com/coaching. It doesn't matter if it's your first time or if you've taken the exam 10 times. I got you and I know how to guide you. So come holler at me, you know what I'm saying? Here we go. Question number 26. Mrs. Cruz, an 80-year-old, is diagnosed with pneumonia. Which of the following symptoms may appear first? Shout out to you, Gina. I appreciate you. Is it A, altered mental status and dehydration? Is it B, fever and chills? What is it? Is it C, hemoptysis and dyspnea? Or is it D, pleuritic chest pain and cough? What are we thinking? What are we thinking? So some key things that stick out to me, right? We're thinking about, we have an 80-year-old. We got somebody's Mima. All right. All right. So what do you think is going to happen? What do you think is going to happen with Mima if she ended up with pneumonia? Because pneumonia is what? So that's where you have to use your critical thinking. You have to understand, what is the disease process being presented to me, right? Mima's age has a lot to do with it. All right. So what are those things that are going to be shown to me first? All right. Think about it. Here we go. Hey, Kevin, thank you. I'm doing this. I'm so much fun. Enjoy. Samantha, I'm glad that you're here. Bacterial infection. Okay. Well, let's see what the answer is. All right. Remember, it's all about critical thinking to make a clinical judgment. Here we go in 3, 2. And the answer is A, altered mental status and dehydration. Elderly clients, right, may first appear with only an altered mental status and dehydration due to a blunt immune response. Anytime you have an older patient, if they have an altered level of consciousness, that is not something that is expected, like with dementia or Alzheimer's. If Mima ain't never been like that, something going on with Mima. You know what I'm saying? Now I gotta in depth dig in to see what's going on with her. Okay. So that's part of physiological adaptation, which is 11 to 17% on the NCLEX exam. Third largest section on the NCLEX exam. It says, what older patient is dementia? So if you have an older patient with dementia, what do you think is going, like they're going to be confused a lot, right? Is that expected or not expected? You tell me. All right, here we go. Question number 27. A male client has active tuberculosis. Which of the following symptoms will be exhibited? Is it chest and lower back pain? Is it chills, fevers, night sweats, and hemoptysis? Is it a fever of more than 104 and nausea? Or is it headache and photophobia? What are we thinking? All right, and this right here, if you think about it, this is a memorization question of some type, right? Because you need to know what the signs and symptoms are for somebody that has tuberculosis. Period. You have to know. There are just things that you have to know. You have to know what everybody else knows. All right. And you have to be able to apply what you know versus trying to apply what you don't know. That's where people get so confused. They're just like, I don't know this. Okay, well, let's apply to what you do know. So you can break the questions down. That's how you do the process of elimination. Okay. I see Monica's name and all I want to say is no, Monica. All right, I'm done. I'll excuse myself. Oh my God. All right, here we go, y'all. Here's our answer. Here is our answer. And 3, 2. And the answer is B. It is chills, fever, night sweats, and hemoptysis, right? So typical signs and symptoms are chills, fever, night sweats, and hemoptysis for somebody who has active tuberculosis. All right. That is part of physiological adaptation, which is the third largest section on the NCLEX. All right. At 11 to 17%. All right. Once you start to understand that it's not new news. Okay. Quality rationale. Shout out to that, right, Gina? You know what I'm saying? Hey, I didn't write them. But we, at this point from nursing school, we should know what the signs and symptoms are. Remember, these reviews are meant to help refresh you, not to teach you. School was the one that was supposed to teach you. And a lot of people get that mixed up, myself included when I was struggling. All right, myself included. So guess what? That's why these are called reviews, not nursing school. All right. So here we go. Question number 28. Mark, a 7-year-old client, is brought to the emergency department. He is tachypnic and afebrile and has a respiratory rate of 36 breaths per minute and has a non-productive cough. He recently had a cold. Form this history. The client may have which of the following conditions? Is it acute asthma? Is it bronchopneumonia? Is it chronic obstructive pulmonary disease, or is it emphysema? What are we thinking? Somebody said, it says, my first time here and I'm enjoying this. You make it enjoyable. Miss Hoskins? Ma'am, you are welcome. I do this all the time. My phone shut down. Oh no. Samantha, I'm gonna need for you to, I don't know, plug that thing in, I guess. Here we go. Samantha, what was the question? We got B's, we got C's, we got A's. 10 seconds, y'all. 10 seconds. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A. It's acute asthma. Based on the client's history and symptoms, acute asthma is most likely the diagnosis. According to Gina, that's a solid rationale. So shout out to you, Gina. So physiological adaptation, 11 to 17% on the NCLEX exam, making it the third largest section. My bad, Gina. Look, see what you did? You done said something, now I'm picking on you, right? But anyways, ladies and gentlemen, we got to understand what our rationales are. If you got it right, cool. If you got it wrong, also cool. But what you're going to do is that you're going to read your rationale, because that is how you retain your information. All right. Content, Q&A, rationale, rinse and repeat. I call that the 360. Can I go back to the question? No. Here we go. Question 29. Is it Marichu, Pikachu, was given morphine sulfate for pain. She is sleeping and has a respiratory rate of 4 breaths per minute. Oh, good God. If action isn't taken quickly, she might have which of the following reactions? Is it an asthma attack? Is it respiratory arrest, seizures, or waking up on her own? What do we think it is? What do we think it is? Not Pikachu. Look, if I don't know how to say your name, I'm just not going to say it. But since this is not a real person, you know what I'm saying. Gina says B. All right, Gina. Is it Arabella says N? I don't even know what that is. I don't even know what, ma'am. I don't know what that is. Oh, okay. I got you. Nadine says D. Okay, I got you. It says she's about to code. She's about to code. It's Kevin Chu. Stop it, Geraldine. Oh, Geraldine got jokes. All right, y'all. Here we go, y'all. Here's our answer. Okay, here is our answer. Pikachu is going in the respiratory. Right? Here we go. And the answer is B. It's respiratory arrest, narcotics, can cause respiratory arrest if given in large quantities, right? And also, you got to think of if somebody has a really good liver and they have really good kidneys and stuff, it doesn't even matter the amount that you give them, right? You could give somebody 0.5 of hydromorphone and they could just be like, oh, they're feeling real good. So one of the biggest things that we always do is we watch for our respiratory rate. Okay, pharmacological and parenteral therapy, second largest section on the NCLEX exam at 13 to 19%. You call me Kevin Chu. That is so hilarious. Oh, man. Here we go. Question number 30. So shout out to all y'all. Hey, give me the 40,000 likes. Hey, make it happen before this question's over. All right. A 77-year-old male client is admitted for elective knee surgery. Physical examination reveals shallow respirations, but no signs of respiratory distress. Which of the following is a normal physiological change related to aging? All right. Based off of his age, what is considered normal? Is it increased elastic recoil of lungs? Is it increased number of functional capillaries in the alveoli? Is it decreased residual volume or decreased vital capacity? What are we thinking? Sorry if you guys hear my son. He's, terrible twos right now. And, y'all know how that goes. You know what I'm saying? Somebody said Model Faces says, thank you for this content, especially or exactly what I was looking for as a current nursing student. Model Face, ma'am, you are very welcome. This is what I do every Monday, Wednesday, Friday at 5:30. You know what I'm saying? So what do we got, y'all? What do we think the answer is? D, some C's. All right, cool. Well, let's see what the answer is. Love them twos? No. He be, you know how they say, like, throw the kids away? Just want to just shoot them like a Steph Curry 3. All right, but the answer is D, decreased vital capacity. Reduction in vital capacity is a normal physiologic change, including decreased elastic recoil of the lungs, fewer functional capillaries in the alveoli, and an increase in residual volume. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section of the 8 client needs sections, but still very, very much important because why? It's part of the 8 client needs sections. All right. So what state do you live in? I live in Texas. It's 7:45 where I'm at. Well, it is 6:45 where I'm at. So that tells me you're on the East Coast somewhere. Not a nursing student at all, but I love this. I'm glad that you love it. I need this practice every day. Look, you ain't getting it every day, but you can get it 3 times a day, or 3 times a week. You know what I'm saying? That's all I'm really good for. After the first couple, I'm tapped out, you know what I'm saying? But ladies and gentlemen, of course, here's a quick recap. Hey, I got those test taking tips over there for you guys to go check out. They're free. 42-page PDF, y'all. 42-page PDF. Also, I got a 700-pager of an ebook you guys can go over there and check out. Also, the 7-day NCLEX course is going for $7 just for you to join the course and the community. After 7 days, it goes up to $48 a month. You guys can hang out. Also, if you are one of those individuals that requires coaching, that needs help, that doesn't know where to start, where to begin, you need help breaking down NCLEX style questions, I'm your guy. Check me out, thebootnurse.com/coaching. Okay. And ladies and gentlemen, that wraps up the questions for tonight. All right. Wraps up the questions for tonight. I appreciate everybody participating. Hey, smash that like button. Give me the 40,000 likes. I appreciate all the love, all the gifts, all the flowers. Once again, I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. Once again, 7-day NCLEX course and community. $7. Go over there and check it out. All right. bootnurse.com/special. There's also that free download you guys can get. Hey, don't forget, you guys can pre-order Conquer It. That link is in my bio. Okay. And also, if you need coaching help, holla at your boy. I got you. And with that being said, ladies and gentlemen, I'm going to turn this camera around so you guys can understand what we got going on right now. You know what I'm saying? So, hey, how y'all doing? How y'all doing? It's morning here in the Philippines. Thank you very much, Sir Kevin. Is it Narsvi? Narsvi, if I said that, shout out to you. I love the Philippines. I actually want to come there and start talking to schools, but that'll come one day. It says, taking my exit HESI in April. Shout out to you. Be studying for it. Alexa says, I failed my NCLEX. Cool. Me too. I failed it 3 times. So my question to you, Alexa, is what are you going to do about it? Says, hi, Kevin. I can't believe I passed that test. Was a beast. It was a beast. But guess what? You passed it and you don't ever got to take it again. Is it Archie? Is it Archie? You're welcome, sir. Stella, you're welcome. Start my RN this year. Shout out to you, Elizabeth. All right. Hey, so like I said, I want to know who you are, where you're from, where you're at in your nursing journey. All right. Also, like I said, with me, I've been a nurse for 3.5 years. It'll be 4 years this summer, June 5th. and I've worked ICU, OR, PACU, so I got a little bit of experience under my belt, you know what I'm saying? So shout out to you. It says, how many days until what? Trey, what did you even say, guy? You got to say that again. Not use Archer. Alexa, you can't say that because Archer has worked for people. There are a lot of people that are like me. I don't like UWorld. Like UWorld didn't work for me, but I still tell people that UWorld is a resource if they decide that they want to use it. But of course, I always tell people to get my course because I like my course and that's my course. I failed LPN 2 times. Okay, Rita, what you going to do about it? Lexington, Kentucky. Shout out to you, new grad. Taking my NCLEX or taking my exam on the 7th. Shout out to you, Jane. You need help. Hey, so if anybody needs help with the NCLEX, you guys can check the link out. So tap this little face right here. Tap the face again. Go to my link tree and then look where it says 7-day coaching. Go to the website, fill out the questionnaire. And once you fill out the questionnaire, you can schedule a call with me. It says, can you pay to take the test without? Absolutely not, Trey. Absolutely not. You cannot pay to take. You can't even pay for the test if you haven't done a nursing program. Can't even do it. What does this say? Alice says, I'm Canada LPN student. I need your help. Okay, Alice, what you need help with? Diamond says, I finished LPN RN in December. I'm looking to take my boards in March. Shout out to you, Diamond. Diamante. RN program prediction test coming soon. Shout out to you, Elizabeth. I'm an LPN struggling with fundamentals. Oh, you right at the beginning. Loveth? You right at the beginning. That's all about the nursing process. That's all about memorization. You got to get it. I would recommend getting into a study group. But only get into a study group for people that are about that action, that are about making moves, not about talking about what they saw on TV or whatever other BS they have going on. From Texas to LPN 9 years, considering going back RN. Is it Priscilla or whatever? Hey, do it. Ain't nothing wrong with that. My goal is to be an L&D nurse. Hey, goals are just, what is it? A goal without or a dream without goals is just a wish or whatever. You already know what I'm going to say. You got to have those actionable steps, Elizabeth. So the goal is to make it there. So what are the actionable steps that you're doing in order for you to get there? Any tips for med-surg? I got offered, but I also got one for peds. But better offer is med-surg offer. So Gabby, I'm going to say it to you like I say everybody else. Where do you want to go and where do you want to work? You're welcome, Alice. Just to share my area in ER, it's freaking, yeah, damn good. Okay, awesome. I appreciate that. Thank you. Is it Narsvi? Oh my God, Narsvi. I feel like I'm messing up your name. I'm sorry. It says, newly grad nurse waiting on my final results. Shout out to you. You're welcome, Jane. It says 23 years LVN. Damn, Christy. Shout out to you, Miss Ma'am. 23 years LVN here. Just started my prereqs for RN transition. AMP now. Shout out to you. You got it. You already know how to be a nurse. You just need to understand the intricacies of the why and now realize that you're going to be the one to do more. And, and you probably have been doing more for a long time. Now you really just have the license to back that up, right? Narrow it down to 2 answers out of the 4, but make sure or not sure which one you want to do. Okay. Well, you got to figure that out. Trey says, thank you so much for this video. You're welcome, sir. Can you please tell me how many times you do live? I do live Monday, Wednesday, Fridays at 5:30. Yep. And you can check that out in my bio because it's in my bio as well. Can you take the test in any state when you have your ATT? Yes, you can. As long as you have an authorization to test, you can take the exam anywhere in the United States, but you still have to apply. So if you live in Texas, but let's say you're going on vacation to Florida, you would have to apply in Florida. You would have to apply at that Florida location, if that makes sense. Working med-surg now, hope for mom and baby. What do you mean? Oh, you hope to get to mother and baby. Hey, you can get into mother and baby. Just make it happen. Does nursing school get easier? No. I mean, it does. You get into a routine, but no, it doesn't because they're going to still bring you stuff out there, Hey, Kevin, how do I access your 7-day course? Aisha, you're already a part of the course. You should all you got to do is go to the library and it should be there. Your library, my library, it has all of your stuff there. It says, taking my NCLEX in exactly 1 week from today. So scared. Natalie, don't be scared. Don't be scared of an exam that don't got no type of emotional tie to you. All right. Get it out of your head. Don't be scared of it. And guess what? You're going to do it scared anyway. All right. So if you've been preparing like you should be preparing, doing your questions, your answers, your rationales, learning your continuously, keeping up with your content, you're going to be all right. AMP. Ain't no joke, though. Christy, I would recommend looking at Khan Academy's A&P on YouTube. I loved it. Rita says, please repeat, how can I get personal help from you? Rita, you can go to the link in my bio. So you would click this little face right here, and then it'll pop up like this, and you pop it again, and it'll take you to my bio. hit the link tree. In the link tree, it'll say NCLEX coaching, and that's how you would find me. Does hospice nurses get paid more? Which section of nursing is paid the best? Coco, it honestly really just depends. You could work ICU. It depends on where you work. You can work med surg. You could be a traveling med surg nurse where they're paying med surg nurses a lot. So it all really just depends. Hospice nurses, they get paid pretty well. So is UWorld helpful? For me, it wasn't, but it has been for other people. Geraldine, you're welcome. If you're scared, go to church. Look, you already know what's up. It says D23, me too. 1 week from today, I take my NCLEX. That's what I've been doing. Shout out to you. What's the best website to study for LPN? My school uses T's, but it's never helpful for the exam. Nurseslabs.com. That's a free website. Of course, well, my website is more geared towards NCLEX, but it does have the stuff that's in there to be helpful for you while you're in school. And then you can also check out, I think Simple Nursing has a nursing school section. You got Registered Nurse RN that's on YouTube. You know, got all kinds of stuff out there. Is it ESME? ESME, it says, is there a big difference between LPN? Yes, 100%. And it's called the scope of practice. There's a scope of practice. That's the big difference. There are things that an LPN can't do that an RN can do. So RN can do everything that an LPN can do and the UAP, but they can't do what the RN does. Okay. What was the AMP site you said? Khan Academy. Khan Academy. I 1,000% recommend going to RN immediately after LPN. The older you get, the harder to remember. That's subjective. Mostly is usually when the people get older, they're just like, oh, they're a lot more solid in their foundation of learning, but that's subjective, It says, I'm going to be an RPN. How do I study? I have a hard time remembering quickly as well. So what I would tell you, it literally is all about repetition. It is all about repetition. That's what it is. Boot Camp and UWorld. Oh, you're talking about like Boot Camp. I know what you're talking about. I've never used them. I've never even been to their website. I've heard of them. UWorld I've used. It didn't really work for me. Does UWorld, is that good? UWorld is good. So if you have a good understanding of content, UWorld is good because they provide a question bank. But me, I'm that one person where I'm just like, hey, give me content, give me Q&A, give me rationales, give me everything under the sun. I'd rather have it than not need it than not have it. I worked hospice for 2 years. It's very mentally draining. Yeah, it is very much mentally draining. Cali Girl, you're welcome. Best NCLEX preparation for LPNs. The 7-day NCLEX course, which is linked in my bio. You can check that out. How do I start studying for Rex PN? I don't even know. I don't know exactly like where you are in your studying, but if you want me to tell you, the best place for you to start when it comes to studying is the area that you have the hardest time understanding. For me, it was pharmacology and it was mother baby. So those two sections is where I started. When it came for me relearning and understanding the content, that would be where I would recommend for anybody. So if like pharmacology is hard, start there first. If cardiology is hard for you to grasp, start there first. All right. If medications, start there. If it's let's say the endocrine system where we talk about diabetes, start there. So hey, if you guys are just now joining, we just got finished doing NCLEX questions. We did NCLEX questions. We did about 30 of them. No, we did 30 of them. We started at 5:30. So if you guys missed that, make sure you guys are liking, make sure you guys are sharing, but most importantly, make sure you guys follow and have that notification button on for when I go live. Okay. Also, I'm writing a book. And you guys can find that in my link tree in my bio as well. And the whole point of the book is to motivate y'all. It's to let y'all know that it's okay for you to be scared, but it's not okay for you to quit at all. I like that you're so honest and doing this. If I was in school for LPN or RN, I would support and pay. Hey, you don't have to be in school to support and pay. You could just support in any way, shape, or form, So if you want to buy the book, or if you want to buy anything else I have going on, or if you want some of the free stuff I got, and cool, you can do that too. You can, there's multiple ways that you support it. You sharing is supporting, because you're getting it to people who need it, right? So there's so many people that need, something like this where I go over questions, or just for the fact where we go back and forth, So Geraldine, you have a good evening as well. Hey, I'm about to go get me something to eat too, so you already know the deal. Bro, is it open on Indigo, like chapter? What are you talking about, Coco? What are you talking about? It says, how do I study from the report sheet from the NCLEX I failed? So I literally just explained that. So for you, go onto your report sheet, see which one is below. See which one is below, and that's where you start. Okay, I'll share it and help people. Just don't end the live yet. I'm not going to end it just yet. Gerald D says, yes, your honesty is well appreciated. You're awesome, Kevin. Thank you. I appreciate it. So, Coco, you're talking about my book. Hold on. Let me go back up and see what you said. Is it open on Indigo? No, it's not. So it's in pre-launch right now. So it's actually not going to be released until June 5th. And if anybody knows the significant date of June 5th is that was the day that I became a nurse. So June 5th seemed like a very appropriate time for me to, or the appropriate date for me to release the book. So it's going to be released on Amazon. It's going to be doing Kindle, as well as we're going to be doing the paperback, and it's going to be all over the place. It's going to be all over the place. Just wondering if your book would be published to Indigo and chapter or in a bookstore. So the goal, it's all going to be it's going to be print on demand, and it's also we're going to be doing an Audible as well. I get anxiety when studying, so the best way to get over that anxiety is to study. You need to study to how the exam is. You got to get over that. That is the best way for you to study, is practice, practice, practice. Go into every single practice exam doing 85 questions at the bare minimum, right? 85 questions at the bare minimum. Treat it like it's the actual NCLEX. And then by the time you go and take the actual NCLEX, you would have already been practicing on fake NCLEXs. You see what I'm saying? So you would have already gotten over that anxiety by that point. Nurse Gabby says, congratulations on your book. Ma'am, I appreciate it. Thank you. It's been a long time coming. And I had a lot of people push me. So shout out to those people that were really doing it for me. So if it wasn't for them, it was going to get written at some point. But they pushed me to get it out, sooner than later, because, why not? We only got one life. and there's no, look, I was nervous and I was scared about releasing this book because it's just like, who am I to write a book? But I don't give a shit about what anybody else got to think about my life and the shoes that I walk. You think I care? So there it is. It says, congrats, Clevin. We love you. Appreciate you, Samantha. Thank you so much. But hey, if you guys are just joining, we got finished doing NCLEX questions. We do them every Monday, Wednesday, Friday at 5:30. All right. And of course, I want you guys to check out everything I got going on. Check out the links in the bio. Hell, like and share the videos where I do NCLEX questions. I don't care how easy you think they may be. You don't know who they are going to benefit and where they are, because sometimes the simplest things we forget. And sometimes for us that do have a larger education and understanding stuff, we forget that. We truly forget where we used to be. All right. And we take that for granted. So you never know. So whatever I post, share it to somebody. You never know if they need it or not. That's the whole point. All right. Trey says, I shared it 3 times. I appreciate you for sharing it, because like I said, you never know who's going to need it. It says, keep this up like this. I need some form of attachment to good people to motivate me. That's the thing. That's the thing. It's just like, I'm all about the good vibes. If you come here and you start doing a bunch of this, I'm going to start doing a bunch of this and I'm going to block you. That's the great thing about TikTok, right? But then, of course, if anybody, I have the 7-day NCLEX course included with a community where I communicate with people in there as well. I only want people that are in there that are going to push other people and that are positive and encouraging. That's what I want. That's the only thing I want here too, because other people need that. All right. Shared and followed. Elizabeth, I appreciate you. It says, please show all Kevin some love. Oh, yeah. I appreciate you, Samantha. It says, but I am nervous to take the NCLEX RN. Well, if you're nervous, sorry, I don't know what you want me to tell you. You're going to be nervous regardless. Who am I to tell you that you would not be nervous? I was nervous when I took it. The only time I wasn't nervous when I took it is when I took it the 4th time. It says, what is NCLEX? I'm really worried to take mine. The NCLEX is the national exam for registered nurses and licensed practical nurses here in the United States. But I'm not going to be one to tell you not to be nervous. But what you can do is to control and mitigate your nervousness is to practice how the exam is. Recreate the testing center. Sit in front of a computer or a laptop. Go to the library where it's quiet. No drinks, no snacks, no phone. Do at least 85 questions. Why? Because your exam is at least 85 questions. If you're going to do the maximum, do 150. Why? Because the maximum amount of questions is 150. Don't do any more than that, right? And then afterwards, read and review your questions and answers. That's how you're able to retain the information. Get into a rhythm of doing that. Put yourself on a study plan. Do time management for yourself. These are the things that you have to do. Somebody asked me, what did I do differently? These are the things that I did differently. I held accountability for myself for what I did do and also for what I didn't do. I managed my time. I cut people off that weren't about my growth in this aspect. You see what I'm saying? And that's what you have to do for yourself. Is it ILO? It says, thanks, Kevin. I truly appreciate it. This is my first time seeing you. I appreciate you being here and I appreciate your questions. It says, yes, I practice 3 times a day and watch my time. There it is. And read the rationale, even if I got it correct. There it is. Where do I click so I know when you go live? I think you have to go to my page, and then it's that bell. It's that bell you have to click to turn the notifications on. Ellie says, just found out I failed my second attempt. I'm defeated. Why? Why are you defeated? Don't be defeated. Ellie, I failed 3 times. I failed 3 times. You get 24 hours you get 20. No, not even that. You get a short amount of time to feel sorry for yourself. And especially with me, you get a short amount of time to feel sorry for yourself. Because you sitting here telling me I feel defeated, I can never beat the look, that's telling me that you're giving up. And around here, we don't do that. Sorry, you came to the wrong live. You thought I was just going to be like, oh, it's okay. Maybe it's just not your thing. I'll never tell you that. I will never, ever, ever tell anybody that was unsuccessful at this exam that, oh, maybe it's just not for you. Hell, absolutely not. You know what's hard? Getting through nursing school. That's what's fucking hard, right? This is just the last step that you need past the finish line for you to get to that next aspect of your career, which is working as a nurse. All right. So what I'm going to tell you is to wipe those damn tears. Okay. Wipe them up. Wipe them up. And then what I want for you to do is I want you to get that performance breakdown, and I want you to see where you didn't do well at. And then that's where I want you to start. If it's pharmacology, you better dive deep into pharmacology content and start understanding and get right back into doing questions and answers. All right. I'm just letting you know. I say that to my coaching. I say that to my coaching students. I say that inside the 7-day NCLEX course. I tell y'all that here. Nothing changes. Nothing is different about it. All right. Thank you so much for the feedback. Nurse Bay, you're welcome. Can a toddler have teddygrams? What kind of question is that, Aaliyah? What kind of question is that? Do you think a toddler can have teddygrams? My son is a toddler and he has teddygrams. I study so much. I'm so sad. So here's the thing. You're telling me you study so much, but how effectively did you study? There's a big difference between studying and studying effectively. I could have just read the book and just went on about my day, but I didn't study effectively. You see what I'm saying? Can a toddler have teddygrams, or is it a choking hazard? I don't know. You tell me. I give my son teddygrams. Anything a toddler eats is considered a choking hazard, period. So I would advise you to watch your toddler while they're eating teddygrams. It says, thanks. I failed my exam on the 23rd. So that was a couple days ago. I appreciate you sharing. Yeah, Rita, you're very welcome. Like I said, I failed. I wear my failures like a badge of honor, because there's how else you don't learn anything. Failing allows for you to be a continuous learner. And that's what nursing is too. You're a continuous learner. You're continuously a learner. Not Ellie with the salute. Look, it says, do you think I study too much? I put 12 hours a day. Absolutely. So now, here's what I'll say to you, Ellie. You can study. I think 12 hours a day is fucking overkill. Absolute overkill. But here's something though, is you could get the same amount of knowledge in half that time spread out over a study plan over a 30 to 45 day period. And guess what? Not cram. And not cram. That's literally what I tell people in coaching. They're just like, oh, what do I do? And I'm like, first off, calm down. Relax. I was just like, you really can go into this thing within 30 to 45 days if you listen to what I'm telling you. So what I tell them is the same exact thing I tell y'all. The thing different that they get one-on-ones with me for like 2.5 hours, to where we go through a whole bunch of stuff. And of course, if that's something that you're interested in, y'all can check me out. Link in my bio as well. Y'all can look at where it says NCLEX coaching. All right. Bella, what's up, Miss Lady? How are you? It says, do you coach for LPN? I do, Jenny. I coach for LPN. If you guys didn't see my testimony where I did with Helen is an LPN and she's in RN school right now. And she passed on the first time up. So shout out to her. But I coach LPN and RNs. It says failed my first nursing program. Now in my second program where I failed fundamentals. So you failed fundamental. I'm confused. Just passed my NCLEX on the 21st with 85 questions. That's what I'm talking about. Shout out to you. Shout out to you. Who said that? Is it Avila? I'm just gonna say Avila. I can't see the rest of it. Or is it Emmy? Emmy. So shout out to you, Emmy. Welcome to the greatest shit show on earth. Congratulations to you. Or did you say February 21 or February 21st? Regardless, congratulations to you. Welcome to the shit show. If there's a piece of advice that you could give, what advice would you give to everybody that's going to take the exam? And of course, once again, congratulations to you. Ellie says, I need your help. Look, Ellie, go to the link in my bio, and then you're going to tap the link tree. And there it'll say NCLEX coaching. Take you to the website, fill out the questionnaire, then schedule a call with me, and then we can see what's up. I'm not giving up, but failing really broke me. So here's the thing. Being unsuccessful at the NCLEX is a learning experience. It's a learning experience. So I bet you right now, if you were to sit on an hour-long call with me, I could literally go through everything that you weren't doing for the last time that you studied for that exam. We flip it, and then you would go forth and you would conquer. You would go forth and you would conquer. All right. It says, Nurse Bay says, how do we sign up for your coaching? So just Nurse Bay, like I was saying, click the link on my bio, right? Once you click the link in my bio, you'll see the link tree. The link tree will take you to my items. In my items, it'll say NCLEX coaching. That'll take you to the website. Fill out all the stuff you need to fill out to get to the website, and then follow the prompts, and then that'll take you to where you can fill out the questionnaire. If you don't have a questionnaire, I can't see you because there's those things I need to know, because coaching is a relationship. All right. You don't recommend Archer. I did Archer full questions and failed with 12 very highs makes no sense. So I'm not even going to lie to you, Ellie. I tell a lot of people to use Archer. However, once again, Ellie, I would say to you is you put in 12 hours of studying a day on top of getting 12 highs, very highs. I'm going to ask you, how effectively did you study? ILO, UWorld is helpful for those, and I said this earlier, UWorld is helpful for those that have a good understanding of content. Me, it did not work for me. And so, but I don't tell people not to go buy it. I tell you, you make the decision. But for me, it did not work. I've coached tons of other people that say that they don't like UWorld, and that's okay, because not every review is going to be everybody's cup of tea. My review is not everybody's cup of tea, but that's okay. But I know that my review works, So, hi, Kevin from the Philippines. I take my exam on the 28th. I'm a bit nervous. What do you advise? You take it on the 28th. So that means you take it on Wednesday. Don't do anything tomorrow. Relax as much as possible and actually organize yourself before you go take your exam. You're going to be fine. You're going to do just fine. And here's the thing. Do not cram tomorrow. If you are trying to cram or do anything nursing related for the NCLEX the day before, that means that you don't believe in yourself. All right. You know it. If you don't know it by now, you don't know it at all. Remember, you don't have to know everything. You just need to know what everybody else knows. You need to know what everybody else knows. Remember, it's all about using your critical thinking, applying it to make a clinical judgment, a safe clinical nursing judgment. That's what the NCLEX wants. Okay. Maybe I'm lacking something. There is no maybe. Ellie, here's what I'm going to tell you. And you're welcome. Is it Alexis? You're welcome. Ellie, there is no maybe. It's a definitive that you're lacking something, and you have to be able to admit that. You have to be able to admit that there is an issue. You just don't necessarily know what that issue is. How can I access my knowledge about preparation I done for my exam? Practice questions. That's how you assess your knowledge. That's the whole point. You acquire the content, apply it to the question, and then you read and review your rationales to retain the information. I call that an AAR, right? And some people, like, military wise, they'll be like, oh, an after action report? No, it's an AAR. You want to acquire the information, apply it to the question, read and review your rationales to retain the information, if that makes sense. All right. Is this Aib? Did I say it right? Saeed? Saeed? Hopefully I said that right. Do you recommend boot camp? If you're talking about my stuff, of course I'm going to recommend that. But if you're talking about boot camp, something else, NCLEX, I personally don't know. I've never used them. I've never used them. But I'll always recommend my stuff. I'll always recommend that. But yeah. But hey, if you guys are just now joining, I'm going to hang out for a few more minutes. We did NCLEX questions. We do them at 5:30 Central Standard Time, Monday, Wednesday, Friday. So if you're not a part of that, make sure you guys are following me. You guys got me to 50,000 likes. You guys got me to 50,000 likes, and I greatly appreciate that. I was going to do a giveaway today, but I'll probably do it some other time this week. I wasn't ready for it, but I'm going to definitely do it. I'm going to definitely do a giveaway for the 7-day NCLEX course. So make sure you guys are a part of that. Okay. Also, hey, y'all, hey, give me the 40,000 likes, y'all. I'm like 300 away. Make it happen right now. There's 50 of y'all. Get carpal tunnel. Make it happen. Also, if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. How can I do that? 7 days. So that link is also in my bio. You can go and check that out. You can actually join the 7-day NCLEX course plus be a part of the community for $7. After 7 days, it goes to $48 a month. All right. It says, how can I do the 7 day? Oh yeah, that's what I just said. Hey Kevin, it's my first time here. Is it Paroli? Hopefully I didn't mess your name up. Welcome to you. Got you to 40. I appreciate you. Thank you, Ellie. Elizabeth says I'm new here. Welcome, Elizabeth. Sam, hey, you know what the deal is. I appreciate you. Here's another thing, by the way. For when the book is released, I'm going to be selling it. I'm going to open up a TikTok shop and I'm going to sell it for everybody that buys a book. That's going to be for everybody that buys the book through the TikTok shop. And it's only going to be exclusively on the TikTok shop is I'm going to personally sign, like, I can't even believe I said this. I'm going to autograph the book and I'm going to actually put a little gift in there as well. When that time comes, it won't be until June. You can still pre-order it any other way you want, but specifically on TikTok for the paperback, that's what I'm going to do for those people. So just be aware of that. It's just another incentive for y'all to come and hang out with me. You know what I'm saying? So is it Aljo? How are you? It says you were $48. Thank you for motivating. I appreciate you. Thank you so much. Hey, I'm telling you, there's a lot of information in there. There's tons of information in there. Let's go. Y'all hit that like button. I love it. So I graduated from my LPN and currently studying for the NCLEX. Shout out to you, D. You were in my live. You were in the live yesterday. And I think you said something about you were looking for coaching. If you're looking for coaching, you got, hey, just go over there and schedule that. That book will be for NCLEX, right? So Ilo, that book is going to be my story of how I was able to conquer the NCLEX. Inside that book will be ways that I conquered it. So it's not going to be an NCLEX book like your traditional NCLEX book where it has questions, answers, rationales, or anything like that. There's a reason why it's called the journey to passing NCLEX. Is because this exam is not just about passing. It's about conquering. Think about it. You opened your mouth either when you were small or when you were a teenager or whatever, and you said, I want to be a nurse because of somebody. It's always been my dream, whatever. Think about how long it took for you to get there. Think about that. How long did it take you to get to the position of taking that exam? Think about that. For me, it took 8 years. I opened up my mouth and I said, I wanted to be a nurse. And then the moment I said that, the Navy was like, cool, you're going to Afghanistan. So there I was. The moment I said it, I ended up in Afghanistan. I ended up there for a year. Probably one of the best experiences that I've ever experienced medically wise. But, you know, it's part of that. You see what I'm saying? So, and then I started doing the prerequisites that required me to, to transfer from state to state, from duty station to duty station. I went to school full time while I was in nursing school. I was working full time as an instructor while I was in nursing school. Did clinicals on the weekends. You know what I'm saying? Everything was a journey. And then I go to take the NCLEX and I fail it the first time at 75 questions. Take it again, fail it at 265 questions. Some of y'all don't know nothing about that. Then the third time I failed it at 106 questions. And I'm like, bro, what am I doing wrong? And right now, hindsight's 2020. It was so simple that I just needed to get my act together. And I needed to get out of my own way and get out of my own head. And obviously what I was doing didn't work. And you know what actually worked? A mentor. I call myself the mentor for all of y'all. If y'all see any of my emails that come through, I say I'm your mentor. If you see any of my emails come through, you see that I sign it says your mentor, because I'm everybody's mentor in this journey to become a nurse. I'm just saying. And so that's what the book is about. It is about the journey of passing that exam so you can get out here and you can do great things of taking care of your patients, but then also you can do great things for yourself. Because once you become an RN or an LPN, I'm telling you, the doors open up to so many opportunities that y'all can't even fathom. Only thing y'all probably think about is bedside, working at a hospital, maybe being a nurse practitioner, going to be a CRNA and just doing patient care. Oh, no, 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 no. There's so many other things y'all could do. So many other things. All right. So just think about that. So that's what the book is about. It's just my journey, but it's a motivational journey with steps, actionable steps that are in there for y'all to take to do better for yourself. It doesn't matter if it's your first time taking it or if you've taken it multiple times. I figured how to schedule it. Okay, cool, D. All right, cool. Hey, and by the way, hey, I don't think I saw you come across my calendar. So if I ain't seen you come across my calendar, you figured out how to schedule it, but you ain't scheduled it yet. You see what I'm saying? So, but shout out to all 37 of y'all out here still rocking with me. Hey, we did NCLEX questions. We did NCLEX questions both for registered nurses and licensed practical nurses. I got them off nurseslabs.com. You guys can go over there and check those out for yourself. Can't wait to read it. And thank you for helping us on our journey. Absolutely. I got you. Hey, it ain't about me. It's about you. D, it ain't about me. It's about you and what you want to do. I'm just saying those opportunities are there for you. It's just whatever you decided you want to do for yourself. But yeah, we do these questions Monday, Wednesday, Friday at 5:30. I talked about releasing a book for you guys that don't know it, that are just now joining. Also, I have an NCLEX course. It's going for $7 right now for you guys to join. So essentially you get a $7 trial. So $7 for 7 days. And then after that, it's on a subscription base. So you pay $48. All right. Get that now. I'm just saying, because at some point it's going to change. And y'all know how things happen. You know, yesterday's prices aren't always, yesterday's aren't today's aren't yesterday's, and tomorrow may not be the same. It'll be the same tomorrow, but y'all get what I'm saying. All right. So, what other questions do you guys have? What other questions do you guys have? All right. Today is Monday. Hopefully everybody had a really good weekend, a good safe weekend. Let's see what else we got. I got so many messages coming in because I announced that I'm pre-launching a book. So there's so many other messages coming in. So what else are y'all thinking? What other questions do you guys have about the NCLEX? I need the $7 deal. Then go get the $7 deal. That's it. Go click the link in my bio, go to my link tree, and you'll see it. It'll say 7-day NCLEX course, and it'll take you right there. It'll take you right there. All right. But what other as a matter of fact, I got 41 of y'all in here. So I want to know who y'all are. I want to know where you're from, where you're at in your nursing journey. What questions do you have about getting into school, the NCLEX, nursing school in general? If you're a new grad, what questions do you have in regards to starting your first nursing job? Are you thinking of going back to school if you've already been a nurse for a while? Are you thinking about other avenues that you could work as a registered nurse or even as a licensed practical nurse? Like, what are we thinking? What are we thinking? I was going to hang out here for about another 10 minutes, but you ain't asking me no questions. You know what I'm saying? I'm a CNA. Okay, shout out to you. I want to know more about RN. Is it a good thing absolutely, it's a great thing to become an RN. Because as a CNA, you're very limited on the things that you can do, and you take direction from an RN, right? As an RN, you have a wider responsibility when it comes to scope of practice, when it comes to taking care of patients, such as medical administration, to more critical thinking and really understanding the why a registered nurse does the things that they do. Okay. So you got to think is like if you think about it on the totem pole, it goes CNA or UAP or patient care tech, then it goes licensed practical nurse or LPN, and then it goes registered nurse. Okay, so the registered nurse essentially they're in charge of the team. All right. So of course it's a great thing if you want to go become a nurse, but if you don't want to be a nurse, don't be a nurse. No one's ever twisting your arm. Nobody ever put anybody at gunpoint and say, "Hey, go be a nurse." Nobody's ever done that. All right. So understand, first ask yourself why. Why do you want to be a nurse? I see Christina just joined. Why do you want to be a nurse? Right. And then if you can articulate that and truly understand why you want to be a nurse, and if that's something that you want to do, now start doing the research and pursue that. All right. Elizabeth says, I'm from Cali. I'm in my first semester with a month-old baby. It's hard, but it's not impossible. That's true. Elizabeth, I had like maybe 2 or 3 girls I was in school with that legitimately gave birth in the first semester of school. And one of them actually gave birth twice in school. And I'm just like, hey, I'm gonna need for y'all to calm down, right? Ain't my relationship. Who am I to say that? But it is very much doable. She did it. You know, she lives out in Georgia now doing her thing. So, you know, there's that. It's like I was so disappointed when I got the results. That's okay. You can be disappointed when you get the results. That's okay. That's a normal response. Now, my question to you is, what are you going to do next? Are you going to sit there and cry about it? Or are you going to put in actionable steps? Remember, imperfect action is still action. Are you going to put in actionable steps so you can get back into the swing of things so you can take this exam again? Christina says, I need help studying. I failed 2 of my exams in my first semester. Christina, so you must be in nursing school. Are you in fundamentals? You have to be in fundamentals. So I would recommend, there's so many YouTube channels that are out there that are really good for the first semester, but it's all about memorization. Christina, what I would recommend, and this worked for me, it may not work for you, but getting into a study group. Think about it. You, 3 other people. Some other people are going to be like, no, I study better by myself. Okay. So obviously, you know, you're not doing so well. Now let's see. Let's try something different. You never know. Different is not always bad. Okay. Get into a study group. You, 3 other people, 4 people total. Split the work up. They do some notes. You bring all your notes together. 100% of the work is done and you've only done 25% of it. Does that make sense? And then you guys can study off of one another. Share notes with one another. It's not cheating. I don't care what the hell. So many people get so wrapped up saying like, oh, we're not allowed to share notes. What are you talking about? Why can't you? You sure can. All right. So that would be my recommendation to you. 5 passed, but 4 didn't. It says, I was studying since November in a study group. 5 passed, but 4 didn't. So you mean to tell me total of 9 of you took the exam and 5 of you passed and 4 didn't. Okay. So you guys studied in a group together for NCLEX, or are you talking about for a test, whichever. Now it's all about, we got to think about it. You can study in a group all you want, but it's still an individualized test. You don't take the test as a group. It's NCLEX. Okay. You don't take the test as a group, right? So now you're going to get your performance breakdown or your candidate performance report, and you're going to see where you didn't do well. That's exactly what you're going to do. Like, I don't even know where mine is. I usually have them somewhere, and I'll show you. Mine, like pharmacology was a tough spot for me. So that's where I started. Maternity was a tough spot for me, and that's where I started. Everyone I would study with got kicked out of the program. Damn, that's terrible. I had a lot of near passing. So you had a lot of, okay, you tell me you have a lot of near passing. Which one is below passing? And if you had a lot of near passing, that's telling me if this is the passing line, you're here. You're like here. You're like right there. Or you were doing one of these numbers. You were like teetering above the line and below the line. You know, that's what I would say. All right. I'm going to hang out here for about another 5 minutes if you guys are just new here. If you guys are new here, welcome. We did NCLEX questions. Now I'm essentially doing a Q&A. Also, if you guys are part of the 7-day NCLEX course and you guys are in the community, I did a motivational Monday this morning. On Wednesday, we're going to be doing Content Cafe, which is where I'm essentially going to go through a content. And last week I went over nursing essentials, right? Which is essentially part of knowing fundamentals for NCLEX, right? So that's a part of that. Tomorrow, on Wednesday, we're probably going to be going over pediatrics, right? Pediatrics that you need to know for NCLEX, okay? All my last exams were near passing. What does it mean? That means exactly what it means. That means it was near passing. That means you were teetering. If this is the passing line right here, you were like right under it, or you were doing this number, and then your last bit of questions kept you here. That's what that means. Aljo says management of care. So management of care, delegation, supervision, assignment. Who do you see first? What is the initial thing that you do? What is the best thing that the nurse should do? So on and so forth. I'm getting the 7A. That's what I'm talking about. Go over there and get it. That link is in my bio. Okay. But yes, is it KP Bernardo? That's what that means by the near passing. I wish I had my stuff. Maybe I'll just have it next time. That way you can see it. Is it Rhinelo or Rinlo? Welcome. Oh, you shared it. I appreciate you sharing the live. I think I said your name wrong. Is it Rinlo? You person, Kentucky mom. KP, you are very welcome. So, ladies and gentlemen, that's what it's about. Get out of your own way. So I like to tell a story in regards to, it's called getting off your beach, right? A lot of people get so defeated, but I'm going to tell you this story and then I'm going to get off here. And I say this all the time for you guys that are new here. During World War II, on the beaches of Normandy, France in 1944, the Allied forces invaded France, trying to go stop Hitler from doing Hitler things. Omaha Beach and Utah Beach were probably one of the bloodiest of the war during the largest amphibious assault in all of military history, right? I'm a Navy guy, so I know this, right? It's part of our tradition that we have to know this. When they stormed those beaches, they were getting mowed down by people that were sitting in bunkers. So one or two things happened on the beach. It's either the old saying goes, two people stayed on the beach, those that were dead and those that were going to die. And I use this analogy in a way because so many people are so scared to progress in life. And the NCLEX is a small part of that. Right? Because I blame your instructors, because my instructors, they put the fear, you don't want to take this exam more than once. Okay, old ass nurse that hasn't been fucking bedside in 20 years. What if I do fail? You don't want to. Okay, but what if I do? Like if it's the end all be all, like I couldn't go take the exam again. Anyways, if you stay on the beach, you're going to die. So guess what you're going to do? You're going to be scared while someone's shooting at you. But the question is, what are you going to do? Are you going to stay there and be scared? Or are you going to run your ass that way through the rain of gunfire with a chance of surviving? So I use the story of getting off your beaches. If you stay on the beach, you're going to be scared and you're not going to progress. So what do you want to do? For all 34 of y'all that are in here, do you want to be scared and stay on the beach, not progress or die? Or do you want to be scared and you want to push through the craziness and push through the fear and push through this exam and get off the beach and see another day? So y'all tell me what you want to do. And I already know what the answer is. You're going to be scared, but you got to get off the beach. Right. And that's my analogy. And I love that analogy. If you have never seen Saving Private Ryan, the opening scene of Saving Private Ryan, I've only seen that movie once. I've only seen it once, and it took me a very long time to get through that movie. And when I tell you a long time, I mean a very long time. You have to keep pushing. If you want to know what I mean by getting off the beach, go on YouTube and watch the opening scene of Saving Private Ryan. And then send me a DM of what you think about it. All right. But that, ladies and gentlemen, that will wrap up my live for today. D says, during my nursing program, one of the instructors told me she doesn't see me as a nurse. Who gives a shit? Her opinion of you does not dictate who you are and how you're going to move. You see what I'm saying? You proved her wrong. Your opinion of me has nothing to do with me. That's a you problem. So I'm going to need for you to fix that. They could say they could see you not being a nurse. Well, guess what? When you get that license, go ahead and hold it up. Be like, check me out. And then guess what? It ain't even a thing after that. Right. But of course, it says some instructors are just rude. That's just motivation. Sometimes some people mean it, but you'll know those that mean it, and you know those that won't. So you'll see the gaslighting coming through. But anyways, ladies and gentlemen, it is now 7:30. I appreciate everybody for being here. Of course, make sure you guys are following. Make sure, of course, you guys are liking all the stuff, and you guys are sharing to everybody that may need it. Check me out on YouTube. By the way, these videos do go up on YouTube. In case, if you guys missed them, you guys can go over there and check them out. I have a whole bunch of stuff that's over there. Also, make sure you guys check out, if you need coaching, the 7-day NCLEX course. Make sure you guys go check out the pre-launch for Conquer It, which is going to be the motivational book that I'm going to be releasing in June. Check out the freebies that I got going on. Just go to the link in bio and you guys check that all out. But remember, y'all, you got to get off your beach. You got to get off your beach. So you can use that analogy not just for the NCLEX, but just anything that you're struggling with in life. If it's trying to get more money, if it's trying to be a better person, if it's trying to be a better person with your spiritual being, whatever you want. All right. But you got to get off. That's the only way you can progress. And it's to go that way. All right. So with that being said, ladies and gentlemen, I appreciate y'all giving me the 40,000 likes, and I will see you guys on Wednesday.